Hi everyone, Dr. Jay Mehta here. I lead the chronic pelvic pain and neurology clinic for India, the first of its kind. And today we will be quickly discussing what type of hormonal management we may want to give to a patient who is experiencing chronic pelvic pain. Remember one thing, if there is a known cause, if there is endometriosis, adenomyosis, pelvic inflammation, first we want to treat that. This hormonal therapy is only reserved for idiopathic chronic pelvic pain. If you are a patient with endometriosis and adenomyosis and you are taking some hormones and you are complaining of pelvic pain, that basically means you are doing the wrong treatment, which is the commonest thing in India. You are never going to go to an endometriosis specialist because you will think they are expensive. You will continue to go to your routine gynecology doctor who does not know how to operate endometriosis, due to which they will be putting you upon stupid medications like Dynogest, Elagolix, whatever, right? They are temporary pain relief medications. They do not cure your disease. You will continue to suffer from pelvic pain. You need to go to a specialist and most probably get operated if it is indicated in endometriosis and adenomyosis. Now coming to hormonal management for idiopathic, that means no known cause in the pelvis, but still you are having pelvic pain. So what do we give? We basically like to give low dose progesterones to all these girls, preferably in the early cycle window. That means from the 5th day of the periods till the 25th day of the periods. We want to give these medications, usually for a window of 6 to 9 cycles. This is because giving progesterone can sometimes calm down the pelvic pain sensation in majority of these women. Giving these hormones can help these women establish a subtle routine throughout the month, making sure that their quality of life does not get affected. It can be sometimes due to a defect in the hormones which are being produced from your own ovaries, which is almost impossible to diagnose despite doing an extensive array of blood investigations. But this is a therapy which we give to a lot of women with idiopathic chronic pelvic pain. Does this work alone? The answer is no. When you have idiopathic pelvic pain, you need to give hormonal management along with sleep management, along with behavior management, and sometimes along with relaxation medications, mood elevation. All these things done together, along with behavior management and psychology counseling, will improve the quality of your life by at least 70 to 90% over a window of 4 to 6 months. Because this is a new clinic, we end up seeing that patients who are coming to us from across the country, some of them have a dropout rate. They think that we've paid the money and the treatment has not given me a tangible benefit in 15 days. Remember, friends, for any of these therapies to give you a good tangible benefit, you need to take these therapies at least for a window of 12 to 18 weeks. That means 3 to 5 months. Please remember this. Even hormonal therapy, if you take it only for 1 month and give it up, you are not going to benefit. We prescribe hormonal therapy for a minimum of 6 to 9 cycles. And that is why it takes that much time for the brain to reset the axis in the body. Be very careful, choose your specialist wisely. But if you are a patient with chronic pelvic pain, experiencing any of this, remember a holistic approach from a chronic pelvic pain clinic is going to be something which is going to really add a lot of benefit to the overall quality of life of a patient.